Every society we know of has a law against unlawful killing. Now, why is that? Because society realizes that life is precious, and if you illegally take a human life, you will be punished for that by society.
Yeah, good evening. My name is Trevor Moore. I'm chair of an organisation called My Death, My Decision, and I answer yes to the question, is assisted dying the compassionate choice? The organisation I chair campaigns for a law that would allow terminally ill people, but also those suffering unbearably from incurable conditions like multiple sclerosis, to be able to ask for help to die if they so choose.
Yes, hello, I'm Dr. Nicholas Herodotou. I'm a palliative medicine consultant, one of many years. I work in Bedfordshire Hospitals NHS Trust in the Luton Hospital. I'm a very keen advocate against assisted dying, and because I believe very much that palliative care is the true answer to compassionate care. I was formerly the local branch president of the Motor Neurone Disease Association in Luton for many years, as I used to see newly diagnosed patients with this neuro-degenerative condition.
So before we answer the question fully about is assisted dying the compassionate choice, I think we need to be clear what we're talking about. At the moment, I think most people will be aware that suicide itself was decriminalized back in the 1960s, but it is a criminal offence open to 14 years in prison if you actually assist someone to die. And that can include accompanying them to Switzerland, where you've probably heard of Dignitas. And I would say that we've exported compassion to Switzerland, as it happens, because we have no control over Swiss law on how people are helped to die. And yet they've had their laws since the 1940s, and everything seems to work very well over there. And it's time that we had that system over here. Now, there are around 31 jurisdictions in the world that currently allow assisted dying, and they do vary in the scope of the laws that they have introduced, and they've been introduced in very different ways. But it's time now that we introduced a law in this Parliament, and this is for people, I would say, not just those who are terminally ill, but those who are suffering from neurodegenerative conditions, and conditions which aren't necessarily terminal illness, like multiple sclerosis, or maybe someone who suffers from paralysis. There was a much publicized case of a woman, Sharon Johnston, who'd become paralyzed after falling down the stairs, and she was accompanied to Switzerland in 2022. And the kind woman who accompanied her was then arrested at 5 a.m. in the morning by the police for and being investigated for assisting someone to end their life. And I think that is absolutely outrageous when someone is acting out of compassion. So I would say the current legislation is inhumane in the way that it operates. And we have many lessons we can learn from the other countries that have allowed a law. Now, when it comes to palliative care, which is often the answer that many people who don't agree with an assisted dying law, back in 2019, I think it was, the Office of Health Economics actually produced a report which said that even with the best palliative care, many thousands of people a year would suffer without their symptoms being palliated. And we have to remember, it's not just about pain, it's about quality of life. And I would say that, speaking personally, and I've been a funeral celebrant, and I've visited many people in hospices, and I've also met many families grieving after someone's died. And I've just heard of too many bad deaths that could have been avoided. And I would say that the law as it currently is just protracting avoidable suffering. the Health and Social Care Committee had an inquiry from which they reported earlier this year, and they said that actually, from all of the international evidence they'd taken, they hadn't seen any evidence of palliative care declining, and indeed, in some cases, in some jurisdictions, palliative care had improved. But to me, it's not an either-or question. Palliative care, yes, must be improved, but we are world-renowned. I think we're ranked about the best in the world. But the shortcomings of palliative care isn't a reason not to allow the people the choice to end their lives how and when they choose. So that's my starting point.
Okay, well, thanks for that. I think what might be helpful is, first of all, to acknowledge at least you have a logical consistency, Trevor, in your organization, that unlike the Dignity in Dying vis-a-vis Voluntary Euthanasia Society, which they changed their name to make it sound more nice into the general public's domain, that they advocate for terminal illness as a means for assisted dying. At least you advocate, and you're honest, that you want everyone to have the right to do it. I think it may be helpful to give some sort of definitions about what is assisted dying, because for the Joe public, some people get a bit confused about what is euthanasia, what is assisted dying, what is physician-assisted dying, and in Canada, medical aid in dying. And I think if I could just give a quick summary of what definitions, what is the definition of what we're talking about, assisted dying. Essentially, they're all the same thing because it's intent. So whether you practice euthanasia, which is deliberate ending of a person's life, either by the patient volunteering or even involuntary, or passive or active, you're taking the patient's life prematurely. Physician-assisted dying is merely the doctor giving the patient a medication to take it, or assisted dying is you give them the tablet, whatever they're going to take, and that aids their death. And in Canada, as a lot of people are aware, this is something that's become very legal, but the data coming out is very disturbing. And we know that there are only two main arguments for assisted dying. We'll use that.
Could you just expand on what you have just said about coming out of Canada that's disturbing?
Give some data in a second. I'm just going to give a quick summary. The only two arguments, if I may give, for assisted dying, there's only two arguments. One is autonomy, and the other one is unbearable suffering, which I think you've touched on, Trevor. And I've spent many, many years dealing with lots of people who are very, very ill, both young and old. So I've got a bit of experience in dealing with sometimes horrible cases. Yes, and you're absolutely right. Some people's deaths are horrible. And that's, even if you're the best physician in the world, you're not necessarily going to change people's end. Some people have awful, what's called terminal agitated states, and it can be very, very distressing. Nevertheless, I think the idea of autonomy doesn't actually happen. No one has true autonomy to determine their outcome. Death is not a right. It's an oxymoron. Death is a...
Sorry, but I need to disagree on that, because the whole point about the Suicide Act of 1961 was to decriminalize taking your own life. I say taking your own life because I think commit suicide is baggage from when it was a criminal offence, rather bizarrely.
Oh, sorry, I interrupted you by mistake. Sorry. We're not talking about suicide, though, Trevor. We're talking about legislation that will enable people to have their lives taken with the aid of either a physician or some other process. So I think it's a different argument. If you just let me finish off what I was actually trying to explain, is that the idea of autonomy doesn't happen. No one has true autonomy. If you lived in a desert island by yourself, yes, do what you want. There's no consequences to it. And also the idea that unbearable suffering, it's very nebulous. What does it mean, unbearable suffering? You can't define it. And that's why I think there are three main arguments against the whole issue of assisted dying, because it's definitely not the compassionate choice. There's moral, there's societal, and there's also palliative care, which gives true dignity in dying. And I'll explain what I mean by that. First of all, there is a moral argument. Even humanists, and I'd be interested to hear your argument, say that every human being has dignity. Absolutely right. But why do we have dignity? You know, even Hippocrates, the father of modern medicine, as a pagan, acknowledged that human life was precious. Every society we know of has a law against unlawful killing. Now, why is that? Because society realizes that life is precious, and if you illegally take a human life, you will be punished for it by society. Secondly, as I said, in society, there are consequences to what we legislate for. And you've asked me to give you some examples. For example, if you look at medical assistance in dying in Canada, this is government data. It showed that there was a 35% of patients who actually requested MAID felt that they were a burden to their family. And that, in fact, was very disturbing data that came out of the government's publication. So 35% felt that they were going to be a burden to their loved ones. And that's a very, very serious warning to legislating for something like assisted dying. You cannot prove or show that a loved one is being coerced. Secondly, it devalues that human being. It makes them feel my life is not worth living. Why am I going to be a burden to my family? And if you legalize it, you're going to give people that option. And that's why it's very worrying. Secondly, as you know, in Canada, if you're mentally ill, you can request assisted dying. And
sorry, a fact check there. That is not the case in Canada. They deferred their introduction of any law until 2027. You cannot have an assisted death for mental illness. The other thing you've been saying about taking a life, this is about personal choice. No one's saying that everyone would want this, but if I'm in hospital, as I've witnessed people and loved ones, they can refuse life-sustaining treatment. They can say, doctor, I do not want any more chemotherapy. The physicians have to respect that, and they know what the consequences will be of removing that life-sustaining equipment or not trying that next round of chemo. And so is it really such a leap to say, I'm going to write a prescription for you where you can take the medication? You said taking a life, but it's actually ending my own life, which is a perfectly lawful thing for me to do. And speaking with many practitioners in countries that allow assisted dying, the death is much calmer. The person is often surrounded by their loved ones. They perhaps have their favorite dog on their lap. It's a whole different scenario to be in a hospitalized situation. So I just don't see the, you were saying about killing people, but it's actually their choice to end their life. In some jurisdictions like Canada and New Zealand, you can choose to have an injection, which actually the vast majority of people do because they feel that that's a more sort of, that takes the responsibility away from themselves in having to swallow the medication.
So in answer to your question, not only that you've talked about MAID, but I've got the data which actually says they are legislating for mental illness. In other countries, people with mental illness can request assisted dying. In Belgium, for example, it's actually legal for a neonate to be euthanized if the parents feel that this baby has no reasonable quality of life. And Belgium has become so liberal in its approach to assisted dying that it's actually worrying data. If you look at the data coming out of Belgium, they are the most liberal of countries. Not only that, even the European Court of Human Rights in their recent report says there's a risk of error and abuse in physician-assisted suicide. And what's interesting, that the majority of these member states actually prohibit physician-assisted suicide and euthanasia. Now, I want to give a comment about what you said about, oh, it's lovely, the patient can give himself an injection or herself an injection, they can die. What people fail to realize are the terrible repercussions on family members. Let me give you a quote from the Times newspaper on a widow's anger at assisted suicide of Simon Dinner. And this was in November the 9th, 2018. He, in fact, killed himself, age 57, in a Swiss clinic. And what was disturbing about this article is that she writes this, and her daughter of 18 died of cancer. She was able to deal with that because she had closure. She could love and hold her hand and care for her. But look what she says. She said, she told me this is about her daughter. Then she said this, her widow compared the abrupt nature of his death with that of her 18-year-old daughter's. That felt like somebody had reached into my body and wrenched out my heart. Yet a certain closure closed the rose in me. I knew I had left no stone unturned in an almighty battle to save her. And in the end, her death was soft, gentle, supported, and at home. When she lay down dying, I sat with her in my arms, stroking her head with tiny tufts of hair. But she said, with her husband, in contrast, Simon's death felt unresolved. To me, it felt angry, rejecting, and abrupt. It felt to look like a suicide. Then she said right at the end, I know that his intentions were pure, but surely it is equally brave, listen to this comment, to live with an illness, a disability, to embrace vulnerability, and to accept that none of us really has that much control.
Well, I just to pick up on something you said about Canada and being a burden 35%, what you didn't say was that the same report shows that around the 90% primary reasons for choosing MAID are because of loss of quality of life in a generic sense, inability to.
That's true, but also if you look at, there's been an increase, 30% increase in MAID since 2021, Trevor.
And so being a burden is one of them, but 35% versus 90%, I would say it just shows that the reason people mostly want an assisted death is quality of life. The person you just read out, if that's the death that they want, you know, saying that suffering is something that we should all endure, well, that's fine, but this is a matter of personal choice. What's more reassuring, to see your loved one in bed taking some medication, or coming home, as I have dealt with many families grieving gruesome circumstances in which someone has ended their life. That doesn't have to happen, and this can be done in a very measured way. And I'd highly recommend Dr. Stephanie Green's book, This is Assisted Dying, which has many case studies of what a dignified death people can have if you allow assisted dying.
Let me just give you a couple of two personal examples of why I am an advocate for allowing people to die with dignity. Because I'm sorry to say, it's not dignity in dying that gives dignity. That's an insult. The best palliative care gives true dignity in dying. I'll tell you why. Because I stop many, many times futile medical treatments when patients are suffering relentlessly. Let me give you one example of a man who was seriously ill. He didn't have cancer. He had huge comorbidities. He was draining a bag over 2 liters of fluid from his tummy every day. They were treating him to death with artificial feeding, etc. And the man kept saying he wanted to die. Do you think the doctors would listen to him? I was asked to see him, and I actually said to this patient, you have a legal right to stop all your treatment, providing you're not deemed to be mentally ill, because this is unrecoverable. He was in hospital non-stop. I got the psychiatrist to see him, who agreed he wasn't mentally ill. I stopped his feeding. Do you know, he burst out crying, saying, you're the only doctor that's listened to me. I sent him to a hospital. He died within 5 days with dignity, with his wife, with his children. Do you know, there was such a peace because I stopped ridiculous over-treatment of patients, which is the major problem why people are sometimes requesting to end their life, because we don't know when to stop treating patients. I give people dignity in dying because I stop treatments that are cruel and unnecessary. Well,
I respect you for doing that, and we're talking very much towards the end of life here, but what about people who are aware of what future may await them? For example, I've been talking with someone who has Huntington's and has seen both, it's an inherited condition, and she has seen both parents suffer from it, and she does not want to be in that position. Why can we not allow a person who is totally compos mentis, of sound mind, choose a time when they would rather end their life than face months, years of really quite unpleasant suffering? So I would say that what you did was admirable in those particular circumstances. But what palliative care can't do, and I've heard this from many people, is that it might be able to address pain, but it can't address some of the existential quality of life issues. I was talking to a young man whose grandfather was 83, bedridden, therefore needed care for all of his needs, who felt that he was being infantilized because he was completely helpless. Now, I would say that a man in that situation who actually made the rational decision that he would rather end his life than face months, possibly years of that existential as well as medical suffering should be allowed to be helped to die. And some of you will remember the case of Tony Nicklinson, who had locked-in syndrome. He could have lived for decades. He was campaigning for assisted dying law, and we support him very much in that approach. So that's what I think we should allow.